Welcome to InstaClass by Amity Online. My name is Dr. Radhika Banka, and I'm a consultant chest physician at the PD Hinduja National Hospital in Mumbai. And today I will be talking to you about what precautions to take for COVID and what do you do if you have been diagnosed with COVID. So, coming to the first part of our talk, what precautions to take. So, as the WHO has recommended, so social distancing, that is maintaining at least 1 meter of distance between yourself and others, does reduce your risk of infection. Especially if you are sneezing, coughing, make sure you cover make sure you cover your mouth, and even maintaining distance of greater than 1 meter has shown to reduce infection. Second is the importance of wearing masks. So make wearing a mask a normal part when you are around other people. Wear a mask which correctly fits on your nose, chin, and mouth. Be very judicious when you use your mask. So make sure you sanitize your hands before and after you use your mask, and try to not touch the mask as much as you can. Also, avoid wearing masks with valves. Thirdly, is the important to make your environment safer, and it's very important to follow the 3 C's and avoid the 3 C's, which is spaces which are closed, spaces which are crowded, or involve close contact. And that's where we've seen maximum rise of COVID cases. So it's very important to avoid closed spaces such as gymnasiums, theaters, large gatherings, religious gatherings, and those kind of crowds. Fourthly, regular and thorough cleaning of your hands with an alcohol based scrub or sanitizer is extremely essential. And I'm sure like all of you all do know about all of these measures, but it's very important to reiterate them on and on so that we don't forget any of these important steps. Now, coming to the second part of our talk in terms of what to do, uh, when you do get COVID. So the first most important thing is to look out for the symptoms of COVID, and there's a wide variety of symptoms which can range from a fever, persistent cough, sore throat, just generalized weakness, muscle aches, body ache, loss of smell, loss of taste, and now even diarrhea. Or some people are even presenting with conjunctivitis or redness of your eye. So if you do notice any of these symptoms, then you should get a RT-PCR or a COVID swab done at the earliest. If this does come back positive, it's important that you stay isolated at home, or if you don't have facilities at home, then to go to a quarantine center, and you rest well, most importantly. Wear a mask, and make your family, if you're isolating at home, wear a mask as well, and this is to protect everybody. What's also important is to monitor your oxygen levels and your temperatures 3 to 4 times a day. Now, I do know of a lot of people who get obsessed with measuring their oxygen levels and pretty much have the pulse oximeter throughout the day, but that's not what's needed. What we need to do is just measure it 3 to 4 times a day. What's important for all of us to realize is that, coronavirus itself is a viral infection, and almost 90 to 95% of the population, especially when you're in the younger cohort, just generally recover as a normal cold and cough and a flu. So it's only a very small proportion of patients, a small proportion of the population that goes on to develop complications, and that's why it's important to monitor your temperature and oxygen level. If at any stage your oxygen levels falls below 94%, then you immediately need to get in touch with your physician or get admitted to a hospital. If your temperatures continue spiking beyond day 5 of your symptoms, then again it's a good idea to get in touch with your physicians. There's a lot of anxiety around getting tests and investigations for COVID. So do not generally get tests done at your discretion. Get it done at the discretion of your physician, who will let you know if it's needed or not. A lot of people get CT scans done on the first day of their illness, and we do know that CT scan on the first day of your illness is not going to show us anything. So please be judicious when you get investigations done for COVID, and it's very important to not treat numbers but treat how you feel. um, the other, just going on briefly to in terms of what the medications for COVID are used. So primarily what we need to use for COVID is, if it's just a mild COVID, is paracetamol, and hydrating yourself well. There's very little evidence against the use of ivermectin, favipiravir or Fabiflu as it's commonly called, or any antibiotics, because as we know, COVID is a viral infection. Um, Steroids or remdesivir, these are the other medications you might have heard of, which are commonly used in COVID. But again, these are used only in a select population when your oxygen levels fall below 94%. There has been a lot of use of steroids even in patients whose oxygen levels are bang normal. And in fact, this has been showing to cause more harm than benefit. So even when you are taking medications for COVID, it is extremely important to be very judicious with its use. Uh, the next thing that I would want to cover is the anxiety that's associated with COVID, and it's extremely important to realize that most of the people will get cured by themselves as a normal viral infection. But what is important is just to be, cautious and alert if you do have symptoms of dropping oxygen levels or persistent temperatures. What we do know is that vaccination does reduce the severity of the illness. So, although you can get COVID after the vaccination, and because none of the vaccine efficacies is 100%, but what we do know is that taking your vaccine almost nearly prevents you from a hospital admission or severe death. So it's extremely important to get yourself vaccinated as well. Uh, I'm happy to take any questions if anybody has any questions. So I've been asked how is it to identify whether it's a common cough or COVID symptoms, and that's a really good question. And the answer is that we cannot be sure, but we do know that almost 70% of patients with COVID do have fever as well. So if you do have fever with your cough, then you should get yourself tested sooner um, rather than later. But however, if you do have a persistent cough which lasts more than 2 to 3 days, and especially if you do not have a chronic cough, then it's important that you get this investigated at the earliest. So thank you everybody for listening, and I'm very happy to take any questions, and you can message me if any. Thank you.